Over 4 million deaths in the world are prevented by childhood vaccines. My name is Mary M. Muturi, and this is the Alive and Aware show on Faraja TV. And to help us understand the importance of childhood vaccinations, on set I have a guest who will help us and take us through immunization in children. Karibu sana.
Thank you so much. Yes.
Maybe you could start by introducing yourself.
Okay, thank you. Let me start by saying that I appreciate being here. Thank you so much for having me here at Faraja TV. My name is Joyce Kariuki. Joyce Kariuki is a nurse, a Kenya registered community health nurse, who is over 20 years of experience in this field.
Okay.
So I understand immunization very well.
Okay.
Yes.
Sawa Joyce, maybe unaweza kwa interest ya audience yetu, we can probably speak in Swahili ndio kila mtu aelewe.
Sure.
Ni muhimu gani, umuhimu wa watoto kupata chanjo ni nini?
Chanjo ni muhimu sana because immunization, as you all know, the introduction of vaccines. Vaccines ni hizo vitu sasa inawekwa ndani ya mwili so that you prevent yourself from, there are many infections that are preventable, and by vaccination and especially to children who we all know that the immunity is low, and by immunization you give them, you acquire immunization for the immunity for them so that they are able to prevent themselves from getting the diseases and infections. Yes.
Labda unaweza tuelezea ni chanjo zipi ziko watoto wanadungwa haswa saa hizi Kenya, na manufaa ya hizo chanjo?
Okay. Chanjo ni mingi, especially za watoto, hata watu wazima huwa wanapata chanjo. But for today our interest is for the children. Na ni muhimu sana watoto wapate chanjo kwa sababu we all know that wakizaliwa the immunity is low. Na it is very important because they prevent from various infections and diseases that normally gets children if they don't have the immunity.
Okay.
Ziko magonjwa mingi ambayo zinapreventiwa na hizi chanjo. Na tunazianza from birth. Immediately mtoto akizaliwa the 0 day ako supposed to get chanjo kwa sababu anaweza pata hiyo infection even as early as at birth.
Okay.
So we have in Kenya there is a schedule on how the immunization are supposed to be given to children. Na kidogo maybe nitaelezea kuanzia kuzaliwa. According to KEPI there is a program on immunization that is there, Kenya expanded program on immunization that has a schedule on how the babies are supposed to get the vaccines or the immunization.
Okay.
Yes.
So maybe unaweza tuelezea hiyo ya at birth inazuia labda magonjwa kama yepi? Then after hapo mtoto anafaa kudungwa after how long?
Yes. Kwa sasa hivi at birth kuna immunization ambayo inaitwa BCG. BCG yenye watoto in Kenya tunapeana mkono huu wa left around this area.
Okay.
Na inapeanwa immediately after birth or before 2 weeks are over. Kuna wale watoto ambao uzaliwa nyumbani or maybe somewhere that the BCG is not available, to huwa tuna advise that they get the BCG before 2 weeks are over. There is BCG, there is also hepatitis B that can be given at birth. Nayo pia inasaidia kuprevent ugonjwa wa hepatitis B ambao pia ni ugonjwa very dangerous. Na as you all know that watoto pia wakipata hiyo ugonjwa hizi magonjwa they are fatal. Zingine watoto pia wakipata at that age they can even die. So we better prevent than wait to cure the disease. Yeah, so we have BCG, we have hepatitis B, and we have polio vaccine. We have polio vaccine. Polio is in many doses, and I'll explain vile zinapeano. Lakini kuna hiyo birth polio, so that is at birth. Birth polio is given orally. Orally ni kwa mdomo. most of these injections zingine zinapeanwa hizi vaccine zingine zinapeanwa as injections, zingine kwa mdomo. Yes. At birth we have BCG, polio, hepatitis B. Yeah. So that is supposed to be given immediately the baby is born or within 2 weeks after the baby is born.
Okay.
Yes.
So baada ya hapo chanjo zinaendelea ama tukishadunga hiyo ya at birth tuko salama sasa, hatutapata ugonjwa wote? Chanjo
zinaendelea na nita explain vile according to the schedule that imepeanwa na the government of Kenya ama in Kenya the program how it is. And we start with the BCG, polio and hepatitis B, and we advise mothers to come after 6 weeks. So ndio unasikianga mtoto anasema naenda chanjo ya kwanza, lakini hiyo ikiwa ya kwanza kuna kuaga hii ya birth. So hiyo ya pili inakuaga after 6 weeks. So tunawaandikiaga the dates that they are supposed to come after 6 weeks. When the baby is 6 weeks, nowadays anapata 2 injections. 2 injections. There is another polio that tunaita sasa the first polio. Polio that is oral polio that tunapeana 2 drops. Nayo inazuia ugonjwa wa polio. Ugonjwa wa polio ni ugonjwa wa kupooza kwa miguu. Kitambo sana before polio was eradicated, because hizi immunization ni mzuri kwa sababu zinafanya some of these diseases that we eradicate them. So hatujakuwa na kesi ya polio in Kenya because of the immunization. Na in case one is spotted somewhere, kunakuwa na campaign all the babies wanakuwa immunized with polio na so wapati ugonjwa ya polio. So there is that polio. Sorry, I forgot to say BCG covers for what? BCG at birth prevents baby from getting TB, tuberculosis for children.
Okay.
So we are now in the 6 weeks where we get polio vaccine. We have nowadays rotavirus vaccine. Now that one prevents from rotavirus causing diarrheas. There are those diarrhea diseases that are caused by rotavirus. So we immunize against the rotavirus. So there is rotavirus that is also given orally. Orally means kwa mdomo. Yes. During that visit again, mtoto anapata injection. On the right, we normally advise that babies wapate injections kwa thighs, not on the back. Because at the back we have this nerve, a big nerve that when it is interfered with, it can also cause hiyo kupooza kwa miguu. So we advise so much babies to get the immunizations on the thighs, the outer thighs. So we have one that we give on the right side, inaitwa pneumococcal vaccine. Pneumococcal vaccine prevents from pneumonia diseases. Yes, many of them because they are caused by various nazita pneumonia diseases, because pneumonia is just not caused by one bacteria. Inakosiwa pia na it has species. So that pneumococcal vaccine has prevents against getting those pneumonias. On this other side, we have a vaccine that is a combination of many vaccines that prevents from many diseases. Right now we have one that is called pentavalent. Pentavalent prevents from 5 diseases. That vaccine moja tu, hiyo shindano moja tu imetengenezwa in a way that ina prevent from 5 diseases. Yeah, the 5 diseases we have one whooping cough that we call pertussis. We have another one that is hepatitis B. We have Haemophilus influenza. We also have tetanus. And the fifth one, I'll tell you, but it immunizes against 5 diseases. Yes, that is now our first visit that we call first visit at 6 weeks. Yes.
Then after
in these 6 weeks, Bado, we have something that we call child growth monitoring. Growth monitoring is where we take the weight of the baby, the height, to ascertain whether that height is okay for the age of that baby.
Oh, okay.
So that is growth and monitoring that we really advise that watoto waletwe for growth monitoring. Even after those immunizations ikiisha, we really emphasize that they are brought so that we can do the growth monitoring for these babies.
Lakini hawa si mtoto wa wiki 6 ni mtoto mdogo sana kudungwa sindano 2 kwa miguu. Si ataumia sana?
They are friendly compared to the diseases. If they get those diseases, huwezi sema ati mtoto ataumia sana. And by the way, the shindanos for watoto ni very tiny, ni ndogo sana, so haileti madhara mingi.
Labda unaweza explain why mtoto akidungwa at that point si uchungu sana, but akikaa few hours later anaanza kusumbua, labda anapata joto, anakaa tena ni kama hizo sindano zimemfanya akuwe mgonjwa zaidi.
So it happens, hizo zinaitwa side effect sometimes of any drug, whatever drug, hata kama ni za ugonjwa ama nini, they have their side effects. And with immunization, most of them are very friendly. The way zimetengenezwa zimetengenezwa in a way that it minimizes all those side effects. But in cases it happens. Remember hizi vaccines wakati zinapeanwa zilikuwa zimetolewa kwa fridge, so zinakuwa ni baridi. So by hiyo kabaridi by itself inakuwa kama anesthesia, inagandisha somehow.
Okay.
But the moment hiyo kabaridi maybe imeisha later in the day, anaanza kusikia uchungu. Hizo side effects zina happen, but they don't happen to all the children.
Okay.
So wengine huwa wanapata hiyo joto na wengine huwa wanapata, wengine hufura na wengine pia wanapata hiyo joto ama pain. Ukiguza that part inakuwa painful, but that one happens only for a day. Sometimes inakuwa tu just one day ama hours na inaisha. So we advise that you just watch and in case that fever becomes too much, we also advise that you expose this baby before you rush to giving drugs. We really avoid giving drugs, and especially kuna mama wapenda kuwapea watoto dawa hata before you get you give the immunization, kuogopa ati mtoto asilie. And we discourage this too much because the paracetamol or Calpol, whatever you call the dawa, it reduces the effectiveness of this pneumococcal vaccine.
Oh, okay.
So it reduces the effectiveness. So we really advise that we avoid as much as we can to give that paracetamol or the Calpol.
Okay.
But in cases where babies get a lot of fever and they become disturbed, especially at night or the following day it has persisted, then we advise you can give the Calpol and maybe bring the baby back to the hospital. Yes.
Labda unaweza elezea tofauti ya siku hizi, I think ni technology ama ni advancements in health. Kuna hizi sindano zinaitwa baby friendly. So hizo baby friendly na ni zinagharimu pesa kidogo, si pesa kidogo, pesa utagharimika ndo mtoto wako achanjwe baby friendly.
Yes.
Labda difference ya hii baby friendly na hii sindano nyingine, mbona baby friendly watoto hawahisi uchungu ama wanahisi uchungu ama labda haina side effects as much kama hizi sindano za kawaida?
Yeah, kuna those vaccines that zinaitwa baby friendly. Baby friendly vaccines they are private vaccines that tulikuwa tunaongelea kuhusu the government one na the schedule ya government, but they are those private vaccines, or we call them baby friendly vaccines, that have been made in a way that they are not different from these other ones. Okay. But through experiences, some have said at you hawapati a lot of side effect, it is not painful, but there's not much of difference. And even when it comes to the pain and the fevers, mtoto wa kupata fevers atakipo the baby friendly, wengine upata fever bado, because the content of that vaccine is the same one as these ones that we are giving at the government facilities. So zingine, it is the size of the needle that makes it not be, very painful, and there's no like something
yenye watoto watasikia uchungu. Kwa zenyewe sindano wote wanadungwa sindano.
Sindano ni sindano, and sindano you expect the pain, hata ukidungwa sindano bila dawa you feel pain. Uchungu. Yes. So but they are very expensive because they are done privately, and zinakujaga tu in a single dose. They are prepared in a way that it is a single dose. Na some of them they have these drugs combined. Like you see in this government, the government one, you'll get, you have polio injection that is separate from this other one, but in the baby friendly one, you get that they are combined. So you get less injection than this other one. Yes.
Okay.
Yeah.
Sasa tumefika wiki
6 weeks. Yes.
After 6 weeks?
After 6 weeks, tunapeana a return date of another 4 weeks after now the 6 weeks.
Okay.
That is 1 month. Tunaitaka 1 month, but tuna calculate na weeks.
Okay.
So after 4 weeks, so mtoto atakuja nao akiwa 10 weeks. At 10 weeks, we'll do the child growth monitoring. That is take the weight and the height and see whether that baby is growing well and advise accordingly.
Okay.
Yes. During that visit, we give the same injections as the ones we give at 6 weeks.
Okay.
So it is a repeat. Of the same. Okay. So you get the pentavalent, you get the pneumococcal, the oral polio vaccine, and the rota oral vaccine. Yes.
Okay.
Rotavirus vaccine.
Na kuna instances unaweza enda clinic maybe kupata hiyo chanjo.
Yes.
Then unapata one is not available ama it's missing at that moment. For instance, tuseme rota. Kuna wakati rota haiko inapatikana.
Yeah.
So inaweza kuwa na any harm to the child akimiss a dose, like a miss your 10 weeks.
As I said, vaccines are there to prevent diseases. So if you come to a clinic and you don't get that vaccine then, it doesn't mean that ukienda home huyo mtoto atapata that infection.
Immediately.
But likely you never know that, because that is why we give vaccines, so that we can prevent, just in case this baby is exposed, cannot get the virus. But there's no harm. It also depends with the age of the baby, because for like the rotavirus, there's a time it disappeared for a whole 1 year. We didn't get many babies getting the rotavirus infection, but we cannot say that that prevented like the lack of the rotavirus is whatever brought the diarrheal diseases. But for rotavirus, so long as the baby is less than 8 months, can always get the 2 doses. There are only two doses of rotavirus. There are 3. Nowadays there are 3. There used to be 2, but now there are 3. You can always get the vaccine so long as the baby is less than, in fact now it is less than 1 year. So long as the baby is less than 1 year, he or she can always get the vaccine and get the 3 doses in a duration of like 1 month apart. Yes, for the 3 doses. Yes.
So hiyo ni wiki 10.
Tuko 10 weeks.
Tuko 10 weeks.
Yes.
Bado mtoto akona sindano zingine zinamsubiria.
Bado tunaendelea na shindano. From 10 weeks we give another 4 weeks return date, so that this baby can also come for at now 14 weeks for the 14 weeks vaccines. At 14 weeks we'll give the polio vaccine, now the 3rd dose. We can call it the 4th dose because there's another one that we give at birth. So this will be the 4th dose, but tunaitaka 3rd doses, because the first one we start counting from the 6 weeks. So you get the 3rd dose of polio vaccine, that is oral. Yes, oral vaccine. We'll get the pentavalent, the one I said it's for the left side. We also get the pneumococcal vaccine, that is for the right side. And we'll add another injection now at 14 weeks. That is, we call it inactivated polio vaccine. Now an injection type of polio vaccine in addition to the oral polio vaccine.
So atadungwa 3.
Atadungwa 3 na atapata rotavirus vaccine, now the 3rd dose. Yes. We'll continue with the growth monitoring, the height and the weight, and some arm circumference and the head circumference for the babies, so that we monitor the growth of this baby. Yes.
Naona ukiinsist pneumococcal ni ya the right na hiyo ingine ni ya the left.
Yes.
Na ukiswitch kuna any effect?
Okay, there's no effect, but according, you see, this is how it has been scheduled in Kenya, so that you are able to identify. There are those mothers who don't know what injections they were given, and so in Kenya it is done in the right side, so that hata mama mwenye hajasoma kimwambia alidungwa ya hii side, in case of anything you will know that it is this vaccine that caused this and this. So specifically for that side. The same case applies to BCG. There are other countries that maybe BCG is given on this other side. There is no effect. Okay. It's only for identification purposes.
Okay.
Yes.
So after 14 weeks?
After 14 weeks, we continue with monthly growth and monitoring for the baby.
Okay.
So we continue giving the 4 weeks for the return date, so that this baby can come and we do the growth and monitoring. So we're going to measure the height of that baby, the weight, the head circumference, and the arm circumference, to monitor the growth of this baby. So these we insist very much. And in case of anything, we are able to identify whether this baby is growing well, whether this baby has any problem, and we are able to identify the problem very early and sort for help as early as possible.
So this growth monitoring inaendelea for how long? Unajua wazazi wengi after wameona sindano zimeisha wanamalizana na clinics hapo hapo.
Yes, hata sindano bado hazijaisha, tutaendelea. Tutaendelea na sindano. We continue this monthly growth and monitoring for this baby, and we advise that we do this every month until this baby is 5 years old. At least amefika ile age ya kwenda shule, and that one we are not able to do now every month. But it is also important to even continue even beyond the 5 years. But 5 years and below, that is when this baby is vulnerable to many diseases, and is also vulnerable to being malnourished and all that. Yes.
So at what point ndio tunaachana na growth monitoring, sasa tunarudia sindano? Tunarudia how old ndio tunarudi after 14
sasa tutaendelea na hii monthly growth and monitoring until this baby is 6 months. At 6 months we have another vaccine that is called vitamin A vaccine. Vitamin A vaccine prevents from eye diseases, kuna eye that the blindness and those eye infections. For the baby, that is oral. Again, it is given through the mouth. At that time, nowadays, we also advise that baby get flu vaccine. Yes, there are flu vaccines that mostly they are private vaccines, but very advisable because of the way now we are getting many flu for the babies. So at 6 weeks, the baby can get the flu vaccine, and we continue with growth monitoring. Again, at 7 months, we repeat the flu vaccine. They're supposed to get 2 doses initially before 1 year. So they get another flu vaccine, and we continue with growth and monitoring. So all this time we have been doing the weight, the height, and advising the mother accordingly, depending on the baby and the growth, how it is. Yes, we continue again every month for the growth and monitoring until again 9 months. At 9 months, we give another injection, another vaccine that is, we call it measles vaccine. This one prevents against measles disease. It's a viral infection. Yes. From there, we still continue with our growth and monitoring. Yes, every month. Remember, kuna mama anakuja wanasema nitaenda kukerereshwa, niliruka last month, and it is very important, and especially to adhere to the dates, because that one enables us to monitor how this baby is growing. In case of anything, in case of stunted growth, in case of obesity, malnutrition, we are able to identify very early and help this baby. Yes.
Before tuendelee, and before we go for a short break, nataka I want to pose a question, then tutaiongelea after the short break.
Okay.
So umesema flu vaccine ni at 6 and 7 months.
Yes.
Then probably kuna mtu hakudungwa the flu vaccine at that 6 and 7 months.
Yes.
So when we come back, you'll tell us if bado mtoto akiwa maybe over 1 year plus ama over 2 years ama before afikie 5 years,
Yes.
anaweza dungwa the vaccine.
Okay.
Yeah. So we are taking a short break, and as you can see, we are at Hillcourt Resort. Before the end of the show, I'll let you know the kind of services and facilities they have. Thank you for watching. We are taking a short break.